Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a double-boarded cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. Today, we're going to talk a little bit about blepharoplasty and brow lift, or blepharoplasty versus brow lift, and the confusion for patients when they're trying to decide which procedures to do. So, in the most simple terms, okay, and this sounds really stupid, but a brow lift lifts your brow. Okay, that's what it does. Now, if you do a blepharoplasty, where traditional blepharoplasty, we're removing skin, sometimes muscle, frequently fat, from the upper lid, and we are taking this extra skin away here, and it's going to sculpt the eyelid and give you uh, a more youthful eyelid, and you're going to see um, the extra skin obliterates the shelf or the area above the lashes and below the eyelid crease. And when you take that extra skin away, it restores that, as you can see in this picture. Okay, so doing blepharoplasty helps the eyelid. It doesn't do anything to the brow. And this is very important, and it's a hard concept for some uh, patients to understand what it's going to do and what it's not going to do. Now, a lot of patients will have excess tissue here on the side of their eyelid, okay? And this is forehead, okay? Right here, this is forehead, so you can't cut that away. When you're doing a blepharoplasty, that's not going to change. So for people that have a lot of drooping or folded over skin or excess skin on the side or lateral part of their upper eyelid, a brow lift is going to help that, whereas a blepharoplasty is not. And you don't want to have a patient undergo a blepharoplasty and then come in and complain that it didn't take care of this, because they would need a brow and forehead lift to take care of that. Now, when I do brow lifts, and I do them several ways: endoscopic, non-endoscopic, uh, transfollicular, depending on the patient and the situation. But when you do a brow lift, the patient has to understand that that's going to open them up, okay, and they're going to look more alert and more refreshed. But some patients, okay, they don't like that look. When you raise their brow and show them that, they say, "Oh no, I look too surprised," or "I look like a deer in the headlights," and they don't like it. Other patients, when you elevate their brow, they say, "Oh my goodness, I love that. That's how I looked in college, and yes, I want to do a brow lift." So it's
So now let's go and have a consultation with an actual patient, and we'll show you how we discuss this in consultation for patients that are considering brow lift or blepharoplasty or both. So we're talking about the difference between a brow lift and a blepharoplasty, and a lot of patients don't understand this. So when people have this extra skin here, all right, and it will, if you just look straight ahead there at my finger, okay, people have this extra skin, and a blepharoplasty, we're removing this skin. And what it's going to do, it's going to make the eyelid more like this, because right now when this patient relaxes, look up a little bit, okay, right, yeah, just keep looking there. This is what people see when they look in the mirror, and it touches their lashes. So if we're taking this skin away, a little bit of skin and muscle and sometimes fat, then it is going to give them more of a shelf like that, but it's not going to affect the brow. If we do a brow lift, it's going to take a lot of that skin away. And if there's extra skin, then we'll still remove a little bit, but the brow lift will take a lot of that skin. Now, the whole rub in this, understanding the situation, is that this is forehead, and you can't take that away. So people will come in here and this will be low. And if you were just, excuse me, if you were just to do a blepharoplasty, they'll come back and they'll say, "Yeah, well, my eye looks better, but you didn't take that away." Well, you can't take that away, but you can lift it. So a brow lift lifts your brow. I know that sounds pretty elementary, but that's what it does. And if there's 10 millimeters of skin here, if I did a blepharoplasty, relax your brow, please. If I did a blepharoplasty, well, then I'd take 10 millimeters of skin away, all right? And that's just an example. But if I do a brow lift, where I'm elevating the brow And of course, we elevate the whole brow, not just one eye. But if I'm elevating the brow, then there's not 10 millimeters of skin left. Maybe there's 5 millimeters of skin. So if I elevate the brow, then I'm taking away less skin. So the closing thing here, look up here just a little bit like that. The whole crux of this understanding this situation, look up again, is if you're doing blepharoplasty, you're taking skin away, you're going to improve the eyelid, the brow's going to stay where it is. If you're doing a brow lift, that's going to open things up. For people that have very low brows, a brow lift makes them look more alert and more refreshed. Some people love the look of an elevated brow. Some people hate it, so that's a personal decision. But when you relax your brow, when you have this and you have this, if you're doing a blepharoplasty, it's not, keep your brow down, it's not going to address that, okay? To address that, you have to do a brow lift. Hope that makes sense and gives a little bit more clarity to the difference between a brow lift and or a blepharoplasty. Here's a case of blepharoplasty and brow lift. Before and after is on the right. The same patient, you can see how the lid and the brow is improved. Same patient again, the brow is raised and the lid is rejuvenated. Another patient with brow lift and blepharoplasty. It really opens these patients up and makes them look better, more youthful and younger. If you're considering brow lift, blepharoplasty, deep plane facelift, or any cosmetic facial surgery, look me up at lovethatface.com. I'm Dr. Joe Niamtu. Have a great day.